Hello, my name is Lindsay Hager, and this summer I worked alongside of Ms. Virginia Orozco, Dr. Anita Singh, and Dr. Shriram Balasubramanian, studying neonatal brachial plexus nerves post-stretch injury. The brachial plexus is a group of nerves around the shoulder, which when damaged can cause a loss of movement in the arm. Brachial plexus injuries occur in about 1 to 4 per 1,000 births, and 20 to 30% of affected infants experience long-term injuries. Currently, only adult human and animal models for the study of brachial plexus morphology post-stretch injury exist. My objective was to assess neonatal piglet brachial plexus tissue for fiber disruption and vascular damage post-stretch. Brachial plexus nerves from 2 piglets, 3 to 5 days old, underwent varying degrees of in vivo stretch. Paraffin-embedded nerves were sectioned at 7 micrometers. For each nerve, 3 slides were selected and H&E stained, resulting in a total of 54 H&E stained slides. The slides were then imaged using a Leica DMI 4000B microscope at 5x and 10x magnification along the length of the nerve. Each image was scored by 2 independent observers using an adaptive scoring system as seen in tables 1 and 2. The observers were blinded to the extent of injury each nerve underwent. Scores were then averaged by slide and grouped by non-stretched and stretched for analysis. Figure 1 shows representative images of non-stretched and stretched brachial plexus tissue. 1A shows a section of non-stretched tissue at 5x magnification. 1B shows the same section of non-stretched tissue at 10x magnification. 1C shows a section of stretched brachial plexus tissue at 5x magnification, and 1D shows the same section of stretched tissue at 10x magnification. In 1A and 1B, the black arrows show normal nerve fibers, and the white arrows show intact blood vessels. In 1C and 1D, the black arrows show ruptured nerve fibers, and the white arrows show ruptured blood vessels. Tables 1 and 2 display the scoring systems used to analyze the images. Table 1 shows the fiber disruption scoring system on a scale from 0 to 4, 0 being the normal or control, and 4 being complete disruption. Table 2 shows the vascular damage scoring system on a scale from 0 to 2, 0 being none to minimal damage, and 2 being severe damage. As you can see in the bar graphs in Figure 2, at both magnifications, there was an increase in fiber disruption and vascular damage in stretched nerves. This data is based on 6 non-stretched nerves and 12 stretched nerves, both imaged at 5x and 10x magnification. In conclusion, non-stretched nerve fibers were wavy in pattern with intact blood vessels, while stretched nerves showed varying degrees of both fiber and vascular damage. As for future work, conducting these experiments and analyzing the results can lead to a better understanding of the injury mechanism of neonatal brachial plexus palsy. I'd like to thank Dr. Shriram Balasubramanian, Ms. Virginia Orozco, and Dr. Anita Singh, as well as the fellow researchers at the Orthopedics Biomechanics Laboratory and the Undergraduate Research and Enrichment Program for their guidance this summer. Thank you for listening, and I hope you enjoyed my presentation.